Boosting women interest in agriculture. Bootcamp project invests in smallholder farmers. Rethinking Ghana's COVID-19 levy. Need for its transformation into public health emergency fund. Shuat appeals to President Akufo-Addo to urgently sign anti-witchcraft bill. SIGA boss commends staff for active participation in Heritage Month. President Akufo-Addo terminate appointment of Senate Director General.
Muslims urge President Akufo-Addo to assent to LGBTQ bill. Year-on-year inflation rises to 25.8% in March. GHS urges media to promote local foods. Blaze Eye Care presents eyeglasses to peoples in Sisala East.
Now the news in details. Women participation in agriculture-related activities in Ghana has been relatively low despite their effort to make a mark in the sector to effectively contribute to economic growth. A record by the World Bank estimated females' involvement in primary agriculture production at 46.44% of the total labor force. The data indicate that access to resources such as land and essential agricultural services is limited to many women. Owing to the gender gap in agriculture activities, the Cosmos Innovation Foundation, in partnership with MasterCard, a Canadian charity, seeks to ignite the interest of women groups to change the narrative through needs assessment-based program interventions. The KIC Women Bootcamp project was initially designed to provide capacity building and practical skills training for students and graduates, geared at changing their perception of agriculture and entrepreneurship. The project seeks to invest immensely in young people, especially women, to motivate them to consider agricultural activities as worthy careers.
The Western Regional Chief Imam Sheikh Suleiman Amamuzu has called on President Nana Addo Akufo-Addo to assent to the anti-LGBTQ bill to make the practice of homosexuality and lesbianism criminal in the country. He reminded the president that these alien antisocial practices frown upon the culture, customs, and tradition of Ghana. Sheikh Muzu said this when he led Muslim faithfuls to observe Eid prayers at Ezule-Nuanu to mark the successful end of the holy month of Ramadan and inauguration of a new independent Edo Fitr Center for Muslims at the Ezule-Nuanu mosques. For the past 50 years, Muslims at Ezule-Nuanu have observed Juma prayers balanced along the line and had always joined their counterparts at the district mosques at Kumbanli for the Eid Fitr celebration. The regional chief imam wondered why countries such as America restricted men to practice monogamy, yet exert pressure on other countries such as Ghana to practice LGBTQ+, which is against their religion and culture.
I would have lost my life to COVID-19 if my family were poor. Despite the government support and interventions, they were not enough to save my life from the dreadful virus. The country's health system is challenged, and any outbreak of infectious diseases could be devastating on the population if care is not taken. Mr. David Dano, a survivor of the COVID-19, disclosed in an interview with the Ghana News Agency in Cape Coast. People spend hundreds of cedis to ensure they access the best health services and treatment for the disease. Also, contact tracing was a major challenge. Those with whom I got into contact before testing positive were not traced and quarantined. This is one of the examples of the many loopholes in the health system. The country needs robust healthcare structures to ensure its preparedness to counter any form of emergency. This is where adequate funding must be prioritized. It is against this backdrop that the COVID-19 experience should be a case study to identify the shortfalls, strength, and weakness in the Ghana's health system.
The year-on-year inflation rate rose to 25.8% in March, from 23.2% the previous month, the Ghana Statistical Service said on Wednesday. This means that in March 2024, the general price level was 25.8%, higher than March 2023. Month-on-month inflation between December 2023 and January 2024 was 2.0%. At a press briefing, Professor Samuel Enim, the government statistician, said food inflation was 29.6% compared to last month's food inflation rate of 27%, with the month-on-month food inflation being 1%. Non-food inflation rate stood at 22.6% in March, up from last month's non-food inflation of 20%, with a month-on-month inflation rate of 0.7%. Inflation for imported items was 23.8%, compared to that for locally produced items, which was 26.6%. On regional basis, The Upper East recorded the highest inflation rate of 42.9%, while the OT region registered the lowest inflation rate of 14.3%.
The Commission for Human Rights and Administrative Justice has appealed to the President Nana Addo Dankwa Akufo-Addo to, as a matter of urgency, sign the anti-witchcraft bill passed by Parliament some 9 months ago. The Commission said the bill, when assented, will tackle head-on witchcraft allegations and attacks in the country. Mr. Joseph Whittal, Commissioner for Shura, said this on the sidelines of National Policy Dialogue on Access to Justice for Women Accused as Witches in Ghana, organized by Shura and Crossroads International. He said witchcraft allegations and attacks were still ongoing in some parts of the country because there was no concrete law to prescribe punishment for persons involved. The practice is still ongoing on the ground, and the main instrument to cease or force the practice to come to an end is the deterrent of the bill, he stressed.
The media has been called upon to promote local foods in a bid to ensure quality nutrition among the populace. Ms. Akufo-Addo Asari, Programs Manager of the Diet and Healthy Life Program of the Ghana Health Service, said the nutrition landscape was changing from healthy diets to unhealthy food as nation witnessed a shift from traditional to modern foods. She said the increase in lifestyle diseases and obesity connected to mostly ultra-processed foods had majority lacking key components such as fiber. Ms. Addo Asari made the call while engaging media practitioners in the Volta region at a 3-day workshop on nutrition, organized by the Africa Catalyzing Action for Nutrition, a non-for-profit organization with a focus on delivering a healthy and well-nourished Africa. She noted a growing trajectory of undernourishment and obesity and said young people registering non-communicable diseases showed a shift in disease burden. The concept of locally available food is very important. It is very sustainable, and so the media should promote these local foods.
Mr. John Boedu, the Director General of the State Interest and Governance Authority, has commended staff of the authority for actively participating in the just-ended Heritage Month celebration with the colorful Repure Region Fair. The level of engagement and participation has been truly exciting, and your enthusiasms have made this celebration very memorable. Throughout March, SIGA staff engaged in various activities to highlight Ghanaian culture by dressing in a traditional African print. The day featured an interdivisional quiz on Ghanaian history and SIGA, accompanied by performance from the talented Kwampa Band. Awards were presented to some divisions of the authority for their outstanding effort, with the Planning, Monitoring and Evaluation Division winning the coveted Heritage Tribe 2024 Award, and Information Technology Division clinching the Innovation Tribe Award. Meanwhile, Millicent Afo and Philip Quatson from the Finance Division were praised to commemorate Ghana's colonial past. The pinnacle of the celebration was the Repure Region campaign and food fair, where staff showcased their regions with traditional attire and dances.
Bliss Eye Care, a private eye clinic in Wa, has presented eyeglasses to 24 school children in Sisala East Municipality, after they were diagnosed with various eye conditions that impeded their effective participation in academic activities. The clinic conducted a free eye screening and treatment exercise for about 305 children at the weekend, out of which 24 had refractive errors and required eyeglasses to aid their vision. Another 241 of the screened pupils had pathological issues and were given medications. 15 had cataract and glaucoma, while about 25 of them had normal eyesight.
President Nana Addo Dankwa Akufo-Addo has terminated the appointment of the Director General of the Social Security and National Insurance Trust, Dr. John Ofori-Tinkwine. A statement issued by the Office of the President and signed by Nana Bediatua Asante, Secretary to the President, directed to Ofori-Tinkwine to hand over to Mr. Kofi Busumpem Osafo-Mafo, the Deputy Director General for Investment. Reference is made to your appointment letter dated July 1st, 2019, issued by the Public Services Commission. In accordance with the paragraph 8 of the said appointment letter, I regret to inform you that the President has terminated your appointment effective April 15, 2024, with 3 months' salary in lieu of notice. The statement said, according to the statement, to enable a smooth transition, Dr. Ofori-Tinkwine should kindly hand over and cease to act as the Director General of the SNIC no later than close of business of Monday, April 15, 2014. 2024, beg your pardon. It also asked him to collect any terminal benefits to which he was entitled. The president thanks you for your service to the nation and extends his best wishes, the statement stated.
Thanks for spending your evening with us. I am Sabi Joseph.
And I am Benson Edem.